My name is Jacob Dombrow. I am in Chemistry 101 lab. This is my clinical presentation. So we're going to go over the patient overview first. An Asian female visits her primary care physician after slipping in the shower. She reported feeling dizzy prior to her fall. She's at 55 years old, 5 feet 2, and 110 pounds. Her blood pressure was 110/70 at the doctor's office. So some initial observations that I saw with the patient was a normal blood pressure of 110/70, which is normal for her age. It is noted that she's small, possibly malnourished, just because of her size, possibly ethnicity as well, because of Asian descent. She reported showing signs and symptoms of dizziness and eventually falling, so we can hypothesize that her body is somewhat out of homeostatic balance. My actual hypothesis, though, is based on the given patient history. She possibly has hypoglycemia or is hypoglycemic. So we're going to go over the glucose determination test first. So the glucose meter test, also known as the blood glucose test, was performed by placing a drop of blood on a test strip and inserted into the meter. Glucose is a type of sugar in the body, and it is the body's main source of energy. The hormone called insulin moves glucose from the bloodstream and into the cells. And that is from a source that I quoted in my reference. For the patient, the meter recorded a 60 milligrams over deciliters, which is abnormal and lower than the average 70 to 100 milligram per deciliter for a fasting patient. And then somebody who isn't fasting would be around 125 milligrams per deciliter. So I would say that was one of the things that stood out to me the most. Was that low glucose blood test. So we're going to go over the Benedict's reagent test strip, which was also performed on the patient's urine sample to check for color changes. The color result was blue, which indicated a negative or normal result. So we can infer that there's no glucose detected in the urine. And then we did a urine reagent test strip, and that checked a small portion of the urine sample applied to a test strip to determine the current patient's blood sugar levels. And we had about a 0.10 millimole per liter, which indicates a normal range in urine, which is a 0 to 0.8. We're going to go over the enzyme kinetics. So the clinical tests were performed using samples of the patient's blood and urine for diagnostic of the enzyme kinetics. It studies enzyme reaction rates and how they are affected. So there was two types of tests that we did and we graphed. We had the CK and LD. CK is the creatine kinase and the LD is the lactate dehydrogenase. And they can be found in tissues that help with energy production and metabolism regulation. And the test performed are used to see if there is muscle damage after RE aerobic exercise or even damage to membranes of the muscle cells. That is also a reference that is going to be in my reference site. That's going to be referenced from my reference page at the very end of the presentation. Due to the data provided from the patient absorbance levels, the CK levels were reported as normal, and the LD levels were also normal as well. We're going to go over the urinalysis. So the urine system removes waste produced by the body and regulates levels of water and other chemicals. It's primarily composed of water, also contains urea, sodium, potassium chloride ions, and creatine. The urinalysis test performed includes physical and chemical composition analysis, and it can be a good indicator for conditions such as kidney problems, endocrine disorders, metabolic diseases. So the protein test was conducted to examine the sample for the formulation of a precipitate, which there wasn't any present. So this indicates no significant extra protein in the urine, which is a good thing. And then the last test, the last test on this page, there's a few more urinalysis tests that we did, was the specific gravity of urine was measured to find the urine concentration, which helps assess kidney function and hydration levels. Because of the water density levels, the patient has a specific gravity of 60 seconds of 1.010, which indicates a normal level as well. And then, let's see, we also did a pH test to measure the pH level. Acidic urine can be signs of starvation, high protein, and maybe uncontrolled diabetes as well. So an alkaline urine level kind of indicates possible renal failure, UTIs, things like that. The patient had a pH sample of 60 seconds. For the 60 seconds of a 6.0, which indicates a normal level of urine acidity, which is, it could be possibly somewhat acidic, nothing hugely out of the normal. And then we did a ketone test, which also ran to find that there's an uncontrolled diabetes. See if there is uncontrolled diabetes from fat being used for energy, which are not normally found. The bilirubin test was performed and is produced when red blood cells break down and processed by the liver and excreted in bile. If the body has problems with liver disease or bile duct problems, bilirubin can be found. The urinalysis test resulted with a negative result with no traces of ketones or bilirubin, which is a good thing as well. So we're kind of just narrowing down. We're getting a little closer. Lastly, the urinalysis concluded with an Ehrlich reagent test to examine the patient's urine sample color changes. So the physical color of the patient was a medium yellow color, which indicates it indicates a healthy level. Means they probably hydrated. A color of like a pinkish reddish color could mean that there's a high concentration of that urobilinogen, which is possibly means like possibly liver disease, hepatitis, hemolytic anemia, or other levels of red blood cells destroyed in the body. Okay, so diagnosis. So the 55-year-old patient of Asian ethnicity was previously hypothesized to have hypoglycemia based on the reported symptoms of dizziness and falling. Since after all the tests that we conducted, which includes the glucose, blood glucose tests with the meter, the urine samples of glucose, we did the pH tests, we did the ketones, we did the CK and LD. Most of those came back as negative or at normal levels. Nothing that I would be worried about. I would say the one thing that stood out the most to me was the blood sugar meter test, which was at a 60 milligrams per deciliter. That indicates to me that she could be a pre-diabetic and she's hypoglycemic. Hypoglycemia can be caused from low carbohydrate intake, which is a main source of glucose, too much physical activity, and not getting enough food when sick. Based on other test results, there's really no other data to conclude a secondary diagnosis or an alternative diagnosis. I would say she could possibly be a diabetic, more in the pre-diabetic phase, but that would require additional testing and a medical provider diagnosis as well. So, and also considering her blood pressure was normal within range. So, we're going to go over the treatment of hypoglycemia. The treatment plan of this condition is dependent on proper dieting. So eating or even drinking proper carbohydrates is vital. Having a variety of nutritional foods, protein with red meats, dairy foods, high fiber intake, whole grain bread, supplementing with leafy greens, vegetables, fruits can also help with glucose levels. It's important for something to be well balanced and to take in consideration that it can't just all be carbohydrates. Also, it's important to have a dietary balance. And some of the things that can greatly impact somebody's glucose levels, this is something that they do in hospitals where you could, patients are administered apple juice boxes, like just literally apple juice, and that can immediately bring up those glucose levels if they are pretty low. And last case scenario, if there's extreme levels of hypoglycemia, patients can be treated with glucogen, which is like insulin. It's literally the opposite of insulin, and it helps regulate blood sugar levels. And a medical provider can prescribe this kit in the event of emergency. In the case of this patient, her levels of her glucose blood sugar levels, it's not something that she would need, but it is a possible alternative if she ever had lower blood sugar levels. And then my references, I have 4 references that I used. One was from Grand Canyon University, which was the lab background. And then we had 2 resources from National Library of Medicine, one for hypoglycemia and blood glucose testing. And then another was from a journal article that was scholarly, with multiple authors and peer-reviewed people, and it talks about the human kinetics that I was talking about earlier. This is my presentation, and thank you for watching.